In this video, I want to discuss my 5 obsolete squat coaching cues so that you can minimize confusion and maximize performance. So after owning 2 personal training studios and 1 physical therapy clinic over the past 12 years, I've had a lot of time to be able to see and coach different squats. And the one key thing that I see that is neglected in the movement world is the language that we use, aka our coaching cues. I find that a lot of us are stuck in the past and we're using obsolete coaching cues that are directly challenging what we really want for our patients. For example, if we want our patient to move straight up and down, sometimes we don't even realize that the language or the cues that we're using are having them move in the exact opposite way. And so they contradict one another. So what I want to do throughout this video is to challenge those obsolete cues and redefine them with new ones. And these new ones, like I previously mentioned, will help minimize confusion for the patient so that they really know the why and what's going on, but also maximize performance because we're not contradicting ourselves with the language that we're using. So that brings us to obsolete cue number 1, push your butt back. Now, how many times have you coached a patient through a squat and used the cue push your butt back? Well, instead, I want you to redefine it with push your knees forward and sit straight down. Now, what is this doing? This is directly helping your patient move through the proper trajectory. In an ideal world, if you're not trying to bias certain things or have a certain modification, a squat should be very elevator, straight up and down, not escalator or horizontally. Now go back to the verbiage that we use. Push your butt back. The obsolete cue literally tells your patient that all you want them to do is hinge, not squat. When you cue them to push the knees forward and sit straight down, you're still getting them to push back, but the focal point is pushing the knees forward. And what happens is they kind of cancel each other out. Because you have one thing going one way, the knees, and the hips are still going back or straight down, the overall trajectory is going to be vertical. So if you are really looking for a vertical squat in a more squat-like pattern, redefine the push your butt back with knees forward and sit straight down. Obsolete cue number 2, head up. How many times have you coached a patient through that sticking point as they're coming up on the ascending portion and yelled head up, head up, head up? It's super common. But what I want you to do is actually redefine that with imagine you have a tennis ball under your chin and don't let it fall. What's going on here with the verbiage that we're using? Well, head up is cueing the patient to literally go in a head up position, which is going to drive extension, which is the exact opposite pattern that we're looking for. Why? Because extension, besides the point of it usually leading to back pain during a squat, is going to drive the horizontal trajectory. So what we do is we redefine that cue, get them at a more neutral pack neck. And first off, let me take a second and does this look comfortable or does this look comfortable, right? And literally just by having them imagine they have that tennis ball under their chin, keeping that neck nice and neutral and open is going to drive more verticality compared to this horizontal trajectory. Again, going after the trajectory that we want by the words that we're using. Obsolete cue number 3, chest up. How many times have you cued that, heard someone else cue that, or just think of that when you're thinking of a squat? It's a classic coaching cue, right? But here's what I want you to redefine it with. Instead of chest up, I want you to cue elbows up and in. All right, and let's break it down. So chest up, what is that cueing? Well, just like we've seen with all these other cues, it's cueing extension. Usually that's gonna contribute to back pain, but the bigger point is it's going to produce a horizontal trajectory. So essentially we're not moving through the right trajectory. When we change to an elbows up and in, we're automatically going to have more of a vertical position because we're in more of an externally rotated position. But I like to take it one step further and give patients a dumbbell, a yoga block, a mini foam roller. It's not really about the weight, it's about holding something. It acts as two main reasons. What happens is when we're in this elbows up and in position, when we hold something, we can actually push in. This inward pull is externally rotating the shoulder. That's going to drive more of a vertical trajectory. But besides that, it's a really nice reference points for patients. This is an extension of the sternum, the ribs, the spine, whatever you want to think of. So as the patient goes down into a squat, if they see deviation of the dumbbell or whatever they're holding, then they're going to know that they're either bending through the spine, they're going in a horizontal motion. If they start to lose it, meaning they can't see the dumbbell, then they're going into an extension. So it's a really great way to act as a reference, but I encourage you to really test it out because it makes it a lot harder for the patient because it makes it hard for them to compensate. So it's a really good cue, elbows up and in. Obsolete cue number 4, drive your knees out. How many times have you thrown a band around a patient's knees and told them to squat by pushing their knees out? I get it, it's super common. But instead, I want you to redefine that with maintain your knee position. So in other words, I don't want the knees moving in, such as knee valgus, but I also don't want them driving out. Here's the thing when we throw a band around the patient's knees. Some of our patients are already at their end range of external rotation and in a concentric shortened position at the glutes, and then we reinforce that with a band. But what we need as movement professionals for a normal, pain-free, full range of motion squat is the ability to change the shape of the pelvis. And essentially we have an external rotation phase, an internal rotation phase, and then back to external rotation. When a patient can move through here, we don't need to start to drive pseudo range of motion through the femur. Why? Because it usually creates a pattern and it gets someone in a position where they don't have movement variability and they get tighter and tighter. So instead, I'd rather encourage them to put a ball between the knees, learn how to squat in a way where they can maintain this vertical position and improve that over time. To me, this is a much better way to improve someone's movement variability so you can maximize their pain-free squatting performance. Obsolete cue number 5. Don't let your knees go over your toes. So we saved the best for last. This is by far the most common and controversial topic out there. What I want you to do is to replace this obsolete cue with slam your knees over your toes. So let's talk about if it's healthy or if it's not. When it comes to knees over toes, people run into trouble when their center of mass is also forward and in front of their toes. So not only are their knees super far forward over the toes, but their center of mass, everything's just forward. But what is this? This is a bad squat. This is bad technique. Just like we would see with any other exercise, if you do it in a suboptimal way with bad technique, you're probably going to have some sort of pain. So what we need to do is we need to be able to push the knees forward, but keep the center of mass back. And with a good squat, that's what should happen. The knees should go one way, the body stays in this vertical fashion, and again, we move in that elevator way. When we can do this, it's really great for two main reasons. One, it's really healthy for the knees. As we go through that squat, the knee needs to be able to maintain its full movement excursion. When someone doesn't go through that, they start to get limited motion. And what happens over time, and point number 2, is the psychology. It starts to really mess with the person. They don't want to go forward. So anytime they go forward, even if it's a little bit, they actually have pain because they've developed such a small limit as far as their knee flexion that really anything starts to cause pain. So I really want the patient to be able to slam their knees over the toes. But again, if the center of mass stays back, it doesn't do it in a painful way, and really they don't really go over the toes, or if they do, it's not very far because they are getting pulled because their center of mass is back. So I hope you're able to utilize these 5 redefined coaching cues. And if you want to take your skills to another level as it relates to coaching and comprehending a squat, then I encourage you to check out our Squat Secrets mini course. It is completely for free. It only takes an hour to complete, and it comes with lifetime access, so that way you always have it as a resource and you can go back as needed. So what I'll do is I will leave that in the link below. Feel free to let me know if you have any questions. And thank you so much for watching. I will see you guys on the next video.